Meck Behavioral Health Care. Our voice, our lives, our community.
Quick little chat with y'all first about what I'm hoping everyone in the room today can do. This might be hard. I want everyone to suspend any previous perceptions or judgments of any kind and be open. This is going to be great. Okay? That's the first thing. Second thing, and then I'm going to hand it over to my fabulous person cohort, Nicole. Okay. Next, again, thank you guys so much for being here. I'm going to turn it over to the president of the Provider Council, Ashley Jacobs.
Good morning, everyone. It's good to see you all today. Just a brief update on the third Wednesday of every month, March 19th, I want to formally invite you to our newly structured Mecklenburg Provider Council Day. We will start at 9 a.m. with training and education. We'll have a general membership meeting from 10 until 11, and then the Provider Network and Quality Management Subcommittee will be from 11 to 12. We are hosting these with our community partner, Johnson C. Smith University. We are located in the Family Dollar Center, and the parking is in front of the Brayboy Gymnasium. So we'll see you then. Thanks.
Thank you. And next we have Miss Sandy Dupuis, who's speaking on behalf of CFAC.
Take these things. Good morning. Good morning. I just have a short update from CFAC. Our president wasn't able to be here this morning, or the chairman of our committee, so usually I stand in for her when she can't come. CFAC has worked over the past several months very diligently to provide the county commissioners and county staff with a consumer's point of view about the merger with Cardinal, and we are saddened to see this local system that has been assembled so carefully over many years by this community of consumers and providers and MeckLink staff and the community stakeholders disassembled. We are saddened about that. And we're concerned about what we know is going to be lost and anxious about another change, as I think everyone is in this room today. But we are ready to move forward. We see this as an opportunity, and we're going to learn how to be successful in the Cardinal system because we still have a job to do. We intend to continue to do our best to be an influential voice for Mecklenburg's consumers and families and to get up to speed as quickly as possible so that we can look forward to being constructive partners with Cardinal just as we have been with Mecklenburg. One final word that I wanted to say, I couldn't possibly leave today without taking a moment to say thank you to the MeckLink's leadership and staff for their respect and support and encouragement that they've given to our CFAC for the past 12 years.
And now, Nicole McKinney. Dr. Nicole McKinney.
Thank you. The secret of change is to focus all of your energy not on fighting the old, but on building the new. Socrates. That quote really resonates with me and is very fitting for today and for the transition that we have ahead of us. And it really speaks to the synergy and the collaborative spirit that we will need to come together to make sure that this transition is a success. So the brief message that I have today for you is to rest easy. Many of us are clinicians, and by virtue of simply being in this industry, we know that change is very, very constant. And it also evokes a lot of stress and anxiety. But Cardinal Innovations is 100% dedicated to ensuring that this transition is successful. And personally, as a Mecklenburg resident, within the scope of my role here at Cardinal, I'm also personally invested in ensuring that this is successful. So let's remember all of the quotes that were shared this morning. We really need to come together dispel any myths and worries that we may have heard. We're going to be here available to answer any questions you might have today to make you feel comfortable and at ease. You'll see that we've scheduled several provider forums for you. This is the first of many that will allow you to ask questions and that will also give us an opportunity to impart information to you to ensure that you have the tools and the resources available to easily navigate the Cardinal Innovation System. So without further ado, please join me in welcoming Cardinal Innovation's Chief Operations Officer, Will Waddell.
Well, thanks, Nicole, and thanks Meck for inviting us to come over this morning. First thing I want to say, I want to give a tip of the hat to the Meck staff, particularly over the last 2 weeks. There's a ton of work to do in a transition like this, and they've been nothing but gracious and attentive, and being in their situation is a tough spot. Managed through some of these things myself, and they've just been totally gracious. We really appreciate what they're doing. It shows a lot of character and a lot of grace. We really appreciate that. Second thing, as we approach the next few weeks, months, and years, Cardinal Innovation's approach, or our philosophy, is that really our providers define our customer experience. You know, when consumers get services or need services, they're not getting those services directly from Cardinal Innovations. They're getting those services from a provider. So when somebody's in need, somebody's getting a need met, they're getting a need met through a provider. Everything we aspire to with Cardinal Innovations, everything we want to do, that is largely being done through providers. Sometimes they'll call our access centers. Some of them will work with our care coordinators. Some of them will interact with our staff. But 99% of the customer experience that goes on out there is with the providers. So really the product, the service that Cardinal Innovations has to offer is you. So it's so important to us. You're our priority. The providers are our priority. Consumers are the ultimate priority, but the only way to make that happen is through our providers. So everything we do, every day we come to work, is thinking about how to translate our aspirations for our consumers, how to translate that through our provider system. You know, there's a couple of things we try to do as a company to make the provider experience more favorable and a little more straightforward also. We try to pay providers quickly. We try to have a low clinical denial rate. Ours is one of the lowest denial rates in the country. We want to be able to respond to you promptly when you have a question. We want to develop vehicles, both digital and telephonic, so when you have a question, you can get your question answered promptly and resolved. When there's service breakdowns or things fall between the cracks, you can get those resolved quickly. Authorizations. We're continually seeking ways to take some of the hassle out of that and make that more straightforward. We're revisiting our authorization timelines, creating situations where perhaps prior authorization is not required. Perhaps you don't have to get one quite as often. Perhaps there's certain conditions and certain types of providers that might have an easier go regarding how on access timelines and how often you have to come back for a prior auth. Our provider councils are very important to us. That's how we get information to inform us what we need to do, what your view on things is. And it's also a great vehicle for us to bounce ideas off providers. Rather than sitting in a room by ourselves trying to think big ideas, we come and test market, collaborate, and work with providers to innovate for our consumers. A couple of things that are most important to us in that regard. Access is very important. Person's in crisis, person wants to come into service, wants to come back into service. They need access to services and assessment and evaluation back into service without an unnecessary delay. So we place a large priority as we're looking at our provider network and how to extend and make ready access available. Crisis services are very important to us. Keeping people out of the hospital as much as possible, keeping them out of the ED as much as possible, and making those services readily available when they're needed and where consumers can know where they are and how to access them. Hugely important to us. Principles of recovery and resiliencies. Promotion of evidence-based practices is a priority for us. More service is not necessarily better care. Evidence-based practice is usually better care. And we also have an emphasis on core services, assessments, medication management, outpatient therapy, basic core services where somebody comes into the care system most of the time and finds their way through the rest of the care system. That is a huge priority for us. on the more immediate things, how do we get this started? I mean, right now, our provider network here can be counted on a couple of hands. It's not very large. So we've got to get between here and April 1st and have a robust provider network. We wish it would have been started. We wish we'd been, starting on this 2 months prior, but it is what it is. So we find our way through that. What we want to do is be able to have providers contract with us and get on board and become get in a way they can see patients. Do that as quickly and easily as possible. In fact, our ambition has been kind of reduced to one thing. If we can send you a piece of paper, you can add one signature to that piece of paper, add a few other documents you should have in your drawer right there, send that back to us, then you're in the network. That easy. So that's our dream. And we are making progress on that dream right now. You're going to hear more detail about that, but we have a way right now. We're in the process right now. We've auto-generated contracts that are personalized to the providers. We've worked with Meck. They've worked with us for delegated credentialing, so you don't have to send us these big cases of materials all over again that you just got through sending in a few months ago. We have a team of attorneys and paralegals in our office that are with us on a temporary basis, but a whole command center ready to take questions and work with us to get this stuff loaded up so we're not spending weeks and months putting stuff in the system. Our allowables are right there on our website so you can see what we're going to pay. We're working through, we're covering the waiver services. We're still determining who's going to pay for state and county funds, and that's going to be worked out soon. I know the date is late, but that's where we are. And regarding authorizations, how to transfer those authorizations into Cardinal Innovations so we hit the ground running, and then for those categories that aren't transferred in, how do you get an authorization in and get that in quickly? You'll hear more from Christine about that shortly. But again, we're trying to, since our time is very compressed here, we need to get it where the lift for you is as light as possible. People stay in service, there's continuation of services, and there's this little service breakdown, as few things falling between the cracks as possible. One of the priorities for us in this first year, this may sound a little strange, actually is stability. As we go from now to the next few months and then to the rest of the calendar year, we are trying to promote some principles of stability in an environment and a market that's ever changing. So we're going to let the Mecklenburg providers, by and large, take care of Mecklenburg consumers, and our Piedmont region providers will continue to by and large, take care of Piedmont area consumers and try to provide some consistency as we transition from one situation to another. Now, I'm going to say the exact opposite of that now, is that the market's always changing, the demands from the department's always changing, and Cardinal Innovations does innovate, so we are not pressing the pause button on everything. So in the midst of trying to create some stability in this transition, we are going to continue to innovate. But the good thing is that's going to be very transparent to providers. It's out there on our website. We go to lengths to make sure that information is available to you and you know all that in advance. I'll just come back around to one last thing, is that, again, the consumer experience in these 16 counties that we're responsible for, by and large, is dictated and developed by the providers. You're our priority. You're what we think about when you come to work every day. And we're going to commit ourselves to make your experience in working with Cardinal Innovations as favorable as possible. And in view of that, we've got two presenters coming now to speak more about the network side and about the authorization side. And Tanya LaGrayson is next. Thanks.
Good morning. Can I see a show of hands of those providers who've received a telephone call from someone from Cardinal Innovations about your contract? Okay, great. 3 things we have in mind: communication, credentialing, and contracting. Our goal is really twofold. We want to make things very simple, we want to do them quickly, and we want to be accurate. But communication first is the key thing we want to do first. So we've been reaching out to you to let you know that contracts are in the mail. We mailed out several contracts yesterday. Has anyone in the room received a contract yet? Okay. They may be in the mail when you get back to your offices today. By the end of this week, all contracts will be out, all new contracts and all amendments. It is very important for you to read your contract very carefully, sign it, and return it to us with all of the required documents in the contract. And there aren't many required documents to return with that contract. We put in the contract all of the sites and services that you had when you were contracted with Meck. If for some reason you receive your contract and you'd like to address some issues in the contract, there's an email address in the cover letter to instruct you on where to send your inquiries. We will get back with you right away. We're going to call you every 3 days until we receive a return contract from you. So we know who we've called, we know how many times we've called you, and we know who we spoke with. So please be sure that the most responsible person in your agency responds to the phone calls and follows up with us. Credentialing. We've been very fortunate to work with the Meck staff to do delegated credentialing. We have a delegated credentialing agreement in place. So if you have a clinician who is currently employed with you and that clinician has been credentialed by Meck, we will accept those credentials. If you have a clinician who's new to you and who hasn't been credentialed by Meck, you'll have to go to our website, follow the instructions, and get that clinician credentialed. Those credentials will be effective on April 1, 2014. Okay? I want to echo something Nicole said about being personally committed to ensuring that this is a smooth onboarding process. I've been a resident of Mecklenburg County for 17 years. I'm a healthcare professional. For 10 years, I practiced pharmacy here, outpatient and inpatient. So I've seen your consumers. We've been working together. We've been helping each other. I've also volunteered with Council for Children's Rights, so those of you who are very passionate about children, I share your passion. There are a team of people at Cardinal Innovations that are clinicians, and they also share your passion. We want to get this right. To the extent that there's a small error, have compassion. It's not because we're trying to do it wrong. We may have just slipped. But have compassion. Let's communicate. Let's move forward. This is going to be very, very easy to do if we're all very responsive to one another, if we all communicate effectively with one another. This can really work, and we're very excited about making it work. So contracting, credentialing, and communication are the 3 key things I want to echo with you. And if you have any questions, please don't hesitate to reach out to the email address, send your question, and we will respond quickly. Christine Beck is going to come up and talk about UM.
So one of the things that I've learned being at Cardinal Innovations for the past 8 years is that there's constant change, and we have to adjust to those changes, and our providers are such a key part of that, getting feedback, helping us brainstorm, helping us make those decisions. And so we're looking to you with this transition as well to give us feedback, to ask us questions, to help us kind of make those decisions. Where do we need to improve? What do we need to look at differently? What information do you all need to make this successful? We understand that you guys have all been providing services, so we need to know from you what kinds of additional information do you need from Cardinal Innovations related to those services, related to Cardinal's expectations. One of the things that we've heard, various rumors and various things, so hopefully I can talk a little bit about some of those myths we may have heard. Cardinal Innovations is committed to offering the same continuum of Medicaid services that exist in Mecklenburg County. We follow the same clinical coverage policies that DMA has in place. So what may be slightly different is the way we authorize those services. We authorize some services differently, but we are always less restrictive than the guidelines. We've made some business decisions to make some services pass through, not require prior authorization. due to realizing those are services that providers, it's high administrative time to send in requests. There are things like psychosocial rehab. Consumers receive that service long term. A lot of those members come for years and years. They have Medicaid. They've been identified as persistently mentally ill. So we review those more on the back end. We look at charts and do some record reviews in that way. So that's just one example of things we've done. And during our provider trainings in the next couple weeks, we'll be looking at those more in detail. But just to give you some kind of overview of some of the big things related to authorizations, because I know that's a big question. Will Cardinal be honoring my authorizations? How do I ensure they know what services I'm providing so there's no disruption to the consumers? So one of the key pieces is outpatient services. We allow, under Medicaid, 24 unmanaged sessions for the year. That starts in January and goes through December. What we've decided to do with this transition is on April 1st, every Mecklenburg Medicaid consumer, that will reset. They will have those 24 unmanaged sessions. So we won't have to worry about, providers won't have to worry about what was already claimed under Mecklenburg, what's going to be, how we're going to count that. Everyone will start fresh. So they will get 24 sessions. That should reduce the amount of authorization requests you'll need to be submitting to us, worrying about whether those will be transferred, how those were done under MechLink. They'll get those kind of start fresh, and then you'll have to request authorizations as those are used probably down the road months from now. For SA data, those of you who are substance abuse providers, you know there's very different rules related to substance abuse and information that can be shared. At this time, we don't anticipate that we will be able to receive the substance abuse authorizations. So what we will do is work closely with those providers related to how to secure those, allowing flexibility, allowing additional time to get those requests in. It's just kind of the nature of working with that population, and we're open to talking with providers directly related to that, related to your individual services on how to best make that transition. Our goal with that is to continue the services, keep members where they're getting services, and then look at the authorization pieces moving forward. For enhanced mental health services, our intent is to honor the authorizations that have already been given. We will transition those into our system as long as they're consistent with MechLink's current authorization guidelines. For example, if a service MechLink standard authorization is for 60 days, as long as that auth was given for 60 days, we'll honor that and transition that in. The only exclusions to that would be if for some reason a site becomes unlicensed or some of those things that are just out of our control. Obviously, we're not able to honor auths in those cases. But 99% of them will transition in and we'll have no problems with. For innovations consumers, our intent is to do the same thing. Those authorizations will transition in as is through the end of their plan years, and then we'll move forward with those. One of the things we've also heard is Cardinal going to deny my services? I have this auth, is Cardinal going to come in and change that? And that is not our intent. Our denial rate, I think as Will mentioned, is extremely low. One of the things that our care management team really works hard at is reaching out to the providers for additional information. If we get a request that there's some concern, it's not clear why criteria is not met, it has the required plan, it has the required signatures, but we just need a little more information. Our first step is to reach back out to the providers, ask questions, let you all know what we're missing, why we're not seeing that criteria is met. And that is done in one of two ways, either through our provider direct system by returning those requests back to you, or sometimes if it's something simple, the care managers pick up the phone and call the identified person and get that information. We anticipate that the first week in March, after the contracts go out, they're signed, all of that, providers will be able to set up an administrator in our provider direct system, and then that administrator, once they've done kind of the steps to that, will then be able to obtain logins for all their other staff at their agency. And what that means then is we're anticipating mid-March, so 2 weeks prior to the April 1st go live date, providers will be able to start submitting requests to us for service to start April 1st. So it's not just April 1st, you have to scramble to try to get everything in. We're planning to do that 2 weeks ahead of time. We're also planning for the initial period in April is to allow a grace period. Our standard is that we typically don't backdate services. However, due to this transition, we understand you're going to be learning our system, you're going to be learning our clinical information, what we ask for in requests. So that will allow us both time to kind of work together, get those questions answered. So for that first 3 weeks in April, we will be backdating those requests back to April 1st as needed, just to allow for flexibility. Our standard process related to authorization requests on the innovation side, plans are 30 days in advance. The annual plan, that comes in. On the mental health and substance abuse side, our standard timeline is that requests should be submitted 15 days in advance and no greater than 30, so for those reauths. So those are just some really high-level, big items that we've gotten some questions on. As we have our more specific provider trainings, we'll be drilling down more into individual services, what may be different than what you're used to. But we just wanted to kind of hopefully ease some fears about the existing authorizations, what's going to happen. And I think several of them have kind of mentioned this already. But we work, my team is all clinicians, and our goal really is to ensure that consumers and families have a smooth transition, that this works well for them, that we work together to continue their services so they get their needs met.
Thank you, guys. So after today, there's a couple of emails up here. These were also in the hot sheet that went out late last night, but you might want to write these down. And now we're going to turn it over to you guys. So we want to know what you think, what questions you have, fears. If you are not comfortable speaking in front of a group, feel free to write them down on the white cards. Make sure that you do fill them out completely, because if we don't get to your question today, someone from the Cardinal team will be taking those cards back and responding. So please make sure you flip it over, fill out the provider name, your name, email, phone number, and try to write legibly as well. Who wants to go first?
I've heard the MeckLink's Alpha is transitioning to the Cardinals system. When is that training going to be for the providers?
Who wants that one? He said that he knows that the Alpha system, which is the authorizations and claims system that we use, is transitioning to Provider Direct. When is that training?
So the Provider Direct trainings are scheduled for March, that we will be doing some of the big overview at the initial trainings that first week in March. And what we do with our Provider Direct system is most of that is online training. So once your administrator is set up, there's lots of different modules within that. So for instance, your claims staff may be reviewing different things than your clinical staff who are submitting authorization requests. So a lot of that is done online, but we will be doing some of that throughout our provider meetings.
And real quick, before we get to the second question, I'm going to have you guys introduce yourselves, if you don't mind. And if you'll stand up and introduce yourself, and then say which, your position and what you're over. Because I think you guys will have some answers.
Hey, good morning. So I'm Jennifer Love Pinnell, and I am our Corporate Mental Health Substance Abuse Care Coordination Manager, located in our Kannapolis office.
Good morning. My name is Jessica Moore, and I'm actually Jennifer's counterpart on the IDD side. I'm the corporate manager for our IDD Care Coordination Unit, located in our Kannapolis office.
Good morning. I'm Renee Snipes, and I am the Director of Financial Services at the corporate office in Kannapolis.
Good morning. I'm Emily Godfrey, Director of Access with Cardinal Innovations at the corporate office.
Good morning. I'm Melissa Covert, and I'm the IDD Utilization Management Manager at the corporate office in Kannapolis.
I was wondering if we could find out what items will be needed with the that they're going to be mailing out the contracts. Would we be able to find out what those items are now?
Sure. And I should say that if you could please get your contract in by March the 10th, that's very important. And because you can't do the provider direct training in your TPA without us having a contract. So the sooner you get that contract back, the sooner you can complete those trainings, and everything can run smoothly. Inside of the contract, you'll find that we're requesting the W-9 form. And your W-9 form should match how you registered with the Secretary of State. So the naming on the W-9 should be the same name that you've registered with the Secretary of State. We're also requesting that you return the federal assurances pages that are in there. There's 1, 2, and 3. Those have to be signed by a witness as well. A lot of times people return those forms and there's only one signature, but those forms do require a witness signature. Also in the packet is the, help me, Jennifer. Right, the certificate of assurance and any license. So it's a certificate of assurance, any license, the W-9, and the federal assurances. Have I left anything off? Okay.
I have a question over here.
Hello. We still have some credentialing issues that have been going on with MechLink since July. We've had some issues with our site location also getting moved within Alpha. I was informed that we should be communicating now with Cardinal on that, and I wasn't sure if we should continue to work with MechLink to get those things set up or just wait and work with Cardinal through the new contract.
With respect to credentialing clinicians that are not currently credentialed with MechLink, you'll have to credential those clinicians with Cardinal. If you go to the website, you'll see a link and just follow those instructions on submitting your initial credentialing form for those clinicians, and then we also use CAQH. So that's how we'll address the credentialing questions. Your contract will contain all of the sites and services that you were contracted with MechLink. So to the extent that there is a site that you're trying to have now, and if it's not in the contract, that will not be in your Cardinal contract. Right. As Will was mentioning, we're responsible for services and sites effective 4/1/2014. If they're not credentialed currently, the effective date for those credentials will be effective 4/1/2014 as well.
If a site isn't listed in the contract, would we use this transition email address to address that, or should we contact MechLink?
If a site isn't currently listed in the contract, yes, you will use the email address that we provided for the transition. We will verify all of your sites and services with MechLink. To the extent that it is not currently contracted with MechLink and you wish to add that site after the 4/1/2014 go live, we will have to address that at that point, because at this point we're addressing the capacity needs in Mecklenburg County and the service needs. If there isn't a service or a site need for that particular, if there isn't a need for that particular site and service, then that site may not be added to the contract right away.
We have several ICF group homes that we are currently billing Mecklenburg through Alpha, but they aren't listed in the physical contract. Would that information be transferred from Alpha to Provider Direct?
It will not if it was not in the contract. So you'll have to submit that issue through the MechLink transition email address, and we'll address that. What's your name?
Mark Phillips. I'm with Autism Services.
Okay, we'll address that.
Okay, thank you.
Thank you. Question up over here up front, and Nicole will go over that way.
Good morning. One, is there going to be an informational session for program participants and consumers as they transition with us?
Thank you. Yes, I'm Director of Community Partners, and we are scheduling at least 6 meetings to be determined. Probably we're going to have them in March and then the first part of April as well. We'll have times during the day, times during the evening, and it'll probably be a total of 12 meetings, 1 to 3 and then 6 to 8. Okay. The first meeting will be March 17th. We'll have flyers out very soon.
Spanish as well. They're going to have Spanish as well. We got one over here, and then we'll come back over there.
Hi, I have 2 questions. I heard you say April 1st resetting for 26 sessions, 24. Is that for adults and children?
Yes, that's for any Medicaid recipient.
Okay. And also, if my company have clinicians that are not transferred under us with MechLink, but they are credentialed, do they have to go through the re-credentialing with Cardinal, even though they're credentialed with MechLink but not under my company?
No, we'll have the information for those clinicians. What we'll have to do is link those clinicians to your agency. Yes, we will link those clinicians to your agency. Send an email through the transition address, and as a 4-1, tell us all of the names of the clinicians, and we'll be able to verify that they are in fact credentialed with MechLink, and we will link them to your agency in our system for 4-1.
Good morning. I know there are a lot of us who are concerned about the county and state funded services, and we're all still in the dark about that. Nobody seems to know. Is there actually a time frame on when we will know? I have a lot of families who are asking me repeatedly on a daily basis what's going to be happening, and I have no answers to give them. So is there a time frame for knowing when we will know that?
Hey, Marty, I recognize your voice. Do you want to? I mean,
so at this time, and I'm sorry, I get that question almost every day myself. I'm Michelle Lancaster with Mecklenburg County, for those of you who don't know me. I can tell you that county funds are going to stay with Mecklenburg County. So if you have a contract with the county, my intent is that those will continue for the services that we are currently funding. State funding, we're hoping to have an answer by the end of the week. And what I've directed staff is if I don't know anything different by Monday, I am proceeding as if the state funds are going to Cardinal, because I have to make some decisions for our organization, just like you do, moving forward post April 1st.
okay, one more. I've got one up here after. And I don't want to forget you guys over here now. If y'all have any questions, raise your hand. Or I can take cards. If you have cards, you can hold the cards up and I'll grab them.
Good morning. I'm wondering when and how participants and providers will be informed of who their care coordinators are and contact information for them.
Real fast for the answer to that. I'm sorry.
Hi, so I'm currently working really closely with the current MechLink care coordination staff on the IDD side to fill the care coordination positions we have available. We actually had more positions available than we had current MechLink staff. So our number 1 priority right now is getting individuals in those positions to make sure we're well equipped to meet the needs of the Mecklenburg community. Once we've identified staff for each of those positions, my goal is to work directly with the identified regional manager who will be located in Mecklenburg's Community Operations Center, as well as the 5 IDD care coordination supervisors that we have identified from current MechLink staff to address caseloads, caseload sizes, caseload assignments, and work on a way to strategically inform consumers and families in a timely manner of who those individuals will be. Our goal is, which is consistent with the theme we've been expressing throughout this meeting, is consistency and ease of transition. So to the degree that we can, we would like to keep caseloads the same. I feel like that would be in the best interest of the consumers and families, so that is our goal.
So are you feeling that by April 1st?
Absolutely. Our goal is that prior to April 1st, you know who the consumers and families will know who the assigned care coordinator is for their case. We wouldn't want anyone to not know on that day who to go to for assistance.
1 second, I have someone waiting.
I know that Cardinal Innovations uses the Gold Star system. How will that system affect providers coming in? Will we have like a neutral rating, or will there be a period where we are given a rating? How will that work?
Yes. Hi, I'm Lisa Bain, Director of Quality Management, and Onika Wilson is our Regional Director of Quality Management. As you know, Gold Star has transitioned to North Carolina Provider Monitoring, NC Provider Monitoring now, and Onika has been very instrumental in working on that panel. Some of you may have also contributed to the current revision and the revision process that's gone on in several weeks to look at the Gold Star process and make that a little more streamlined. So we're very pleased with the progress that has been made, and I think you can expect more progress in terms of streamlining those tools. Having said that, we do not plan to do site visits, re-up site visits. We plan to bring you in as is, and as needed, we will do site visits along the way. Any additions to that, Anita? Ma'am, did that answer your question? Okay, thank you.
I love that quality control. Got to make sure you get it right. Nicole, do you have anybody that's ahead of these up front?
Nope.
Okay.
Good morning. I have 3 questions related to outpatient services. The first one is related to the rollback to the 24 unmanaged visits effective April 1st. Will this also apply to outpatient clients who are in authorizations currently?
So for any outpatient services currently authorized, we will not transition those authorizations into our system, so everyone will kind of have a blank slate. So when you're able to look up your consumers, you'll see them at 24 sessions. That way we don't have to figure out how many units you may have used already based on that authorization or not.
2 more, right?
Thank you. The DMA standards for referrals for outpatient therapy state that the referral must be documented in the clinician's record, and they can come from an in-network psychiatrist.
Can you repeat that a little bit louder?
Yeah. The DMA standards for outpatient services state that a referral must be documented in the clinician's record, and that the referral can come from an in-network psychiatrist, the primary care provider, or the LME. Okay. Is Cardinal Innovations going to send documentation of referrals that they make to a clinician? Okay, and my second question is related to the billing codes and CPT codes for outpatient. I looked through the documents online and I couldn't find anything that I was familiar with.
So to answer your first question, and this is kind of jointly, and I'll look at QM in case I say something they disagree with, but the way we've handled that is if, the access staff or the UM staff make that referral to you, you would just document in your record, referred by Cardinal Innovations, UM staff, referred by Cardinal Innovations, access staff on that date. We don't require a separate form that you receive. You would just have that documented, and then we would have that documented as well on our side in that client's record that we made the referral to your agent until you're set up that appointment. Your question related to CPT codes, that may be something we need to discuss more in depth, but we do use the standard CPT codes. We use the outpatient service codes that are in 8C of the clinical coverage policies. So I would need to know a little more specifically which ones you're referring to, as we do, when we looked at the Link current contracts, our service codes as far as CPT are the same, and so those would transition. So, yeah, so the email right here, if there's a specific code you're concerned about or specific, if you want to email it to that, then we can look into that directly and respond about that.
So let's go back to the referrals, the DMA referrals under 21 Medicaid. You have to have it documented by their primary care physician, an in-network psychiatrist, or the MCO, correct? That's how you understand it? So let's say they call you directly for services, and they're not coming through the call center, and they don't have a PCP, or their PCP hasn't authorized the service, and they're not getting psychiatry either. What do you do at that point? You do not need to refer the caller or their family back through the call center to get that referral. The way Provider Direct works, and we'll go through it when we have our trainings, is you would go into the system and do a client update. And in that update, you will say that you received a direct referral from the consumer. This is their presenting issue, and you need that approved. That approval is your approval from the MCO for that direct referral. The referral you get from the call center is a completed STR, screening triage referral. When we make that appointment, we can provide that STR number to you. You can go into Provider Direct, pull up that referral, and see anything that you need to know about that referral, unless it's SA. If it's SA, you won't see it at all. Does that help a little bit more about the referrals and the documentation from the MCO?
Okay.
Thank you. Regarding the Gold Star rating, some of us have already gone through that process. Will you be honoring those?
Question over here.
I have a two-part question. First of all, our contracts, when do they expire? And secondly, we have authorizations for services that I provide that run typically for the 12 months. How will that play a part with the contract?
The Cardinal Innovations procurement contracts are evergreen, so they don't expire. The Cardinal Innovations procurement contracts are evergreen contracts. There's no expiration on them. They're expired once you terminate or we terminate, but there's no expiration on them.
And then you mentioned your year authorizations. Are you an innovations provider? Are these for innovation services? Yes, we will honor them through the existing end date of those, and then you would request new authorizations in conjunction with the care coordination with the plan development.
Nicole, do you have anybody?
Good morning. In terms of outpatient unmanaged visits, is that per a provider, or do we share those in terms of like I see clients on my own outpatient, and they also see a psychiatrist. So does that a psychiatrist visits count with mine, or is it only that I receive the 24 outpatient visits with that consumer?
Medication services, psychiatric services, E&M codes, those do not count against the unmanaged. Those are unlimited. We don't put a maximum on psychiatric visits. The 24 unmanaged is per consumer. So what you will be able to see in our provider direct system is the count for all providers. So if someone else is seeing, they walk in your office tomorrow, it's 3/4 of the way into the year, you want to know how many unmanaged visits they have left. You can look that up in the system and see the count as of that date. And that's based on claims data, so it is per consumer.
From a contractual perspective, if you are currently doing business in MedLink providing services ABC, and you're also a provider in Cardinal doing services CDE, with the consolidated collaboration, can both services be automatically merged together if you're currently doing and have contracts in both entities?
If you're currently contracted with Cardinal and MedLink, you will get the ABC. So in your hypothetical, if you're contracted with MedLink for ABC, that's what your amendment will say. ABC.
Okay, and is there a way, or is there a timeline that you can bring them all together if you're currently doing both services on both sides? Or when can that be merged together?
Right now, we're going to keep them separately, and we're going to address whether or not the Cardinal providers will be allowed to transition and provide services in MedLink if they're not doing that already. That has not been decided. We want to look at the market. We want to ensure that those providers rendering services in MedLink are stable and that there isn't a huge transition to the market. After some period of time, after we conduct our capacity study and our accessibility study, we'll be able to gauge at that point what additional services or providers we need in the area. But right now, we'd like to keep them separate.
Thank you.
Any other hands or cards? I haven't seen any cards. Y'all, we got 45 minutes left. Come on.
Good morning. I know that MedLink has worked very hard to develop and put into place our provider directory. And as a IPRS provider, we have a responsibility now to link individuals to various services. So that provider directory as it stands today will remain in effect until all of your studies are completed, or, and this is just for the purpose of referring individuals and connecting them to additional services.
Sure. So once we enter your agency sites and services in our Cardinal Innovation System, that data will flow through the provider search engine that we have. So you'll still be able to see all of your sites, all of your services, and that serves as a referral base for access and for stakeholders in the community. So it will be the same directory because your information will come into our system. We call it a search engine, provider search engine. You call it a directory, but it's the same. Oh, yeah.
So we are waiting on that decision.
Right. We're doing Medicaid right now and not IPRS dollars. But to speak to the provider search directory, search engine, that will be intact.
Okay, one. Cool.
While we're on IPRS, I know that's not your area right now, but maybe Michelle can answer. But we know that the state dollars are blended, our IPRS dollars are blended with our county dollars. We've been so fortunate here in Mecklenburg County to have that. Is there still consideration that state dollars will stay here at MedLink? Is that a consideration of the state?
Yes, that's what we've requested because we realize the value of the blending of the funds. And so that's what we've approached the state with, that opportunity, and we're waiting to get an answer back on that question.
Okay, I got one here, another one in the back.
Hello again. This is a quick question. In the Alpha system, Mecklenburg Medicaid recipients are already entered, and in order to bill for them, you update their information to make it part of your profile as a provider. Are Mecklenburg consumers going to be already in the provider direct system, which we just have to pull them down for ourselves?
Yes, we get a daily load from the state of any new eligibles for Medicaid. So if whether they get services or not, they will be in our system if they begin to receive Mecklenburg Medicaid.
Do you have one over there, Nicole?
No, but we have a few cards when you're ready.
Oh, okay, yeah, go for it.
Okay.
Well, no, don't. Let me get back up here.
Okay. Is there a feature in the Provider Direct system access where agencies can post openings that they have for various services that they offer so the clinicians are aware of availability for consumers?
Who wants that?
Not at this current time, but that is something we are working on development. We've just made some significant changes to our Provider Direct system, and we're working with Network moving forward to figure out how to make that useful for providers to know availability with other providers, so we know when we're making referrals. So it's a work in progress.
Okay. Is there any way to get the 2-day training other than going to one of the 2-day events? Will there be other days offered? Will the webinars provide some of the training from the 2-day trainings? I can take that. What we plan to do is actually offer some PowerPoint training voiceovers that we'll post to our website. So the key information that we're going to present at those live trainings will be available for you to access online. And the webinars will actually highlight some of that information as well, not in totality, but to some degree.
Go ahead with your next one.
Will provisionally licensed clinicians be able to bill outpatient therapy under a group practice?
So as long as the provisionally licensed clinicians are associated, they've gone through the same credentialing through our process, they can bill under the group practice. They use the H codes for those services.
When will the network open for other counties in North Carolina?
We're going to be conducting a capacity study. We have all of the providers, sites, and services loaded into CI. We have a data analyst who's working on the demographic information from the U.S. Census and other external sources that he uses to compile demographics and prevalence information. Once we have the study in hand, we'll be able to assess what other services that are needed in Mecklenburg. We'll post this to our website, and at that time, we will entertain enrollment applications to provide those particular services that are in need.
Stay there, Tanyala. If a provider recently moved, what is the process of updating the new contact?
Link transition at cardinalinnovations.org. We sent contracts to all of the addresses that were on file with MechLink at the present time. So that's the address your contract is going to. If you did not submit a change of address form, we will know because we will be calling you. We will be calling you every 3 days until we receive your contract back.
Every 3 days.
Every 3 days. So we will get that information from you directly, or feel free to submit it at the address listed above.
We're all currently assigned provider relations specialists. How is that transition going to occur, and when will we be notified who those individuals are?
We have been fortunate enough to receive a lot of qualified applicants from the MechLink staff, and we are in the process of making final decisions on those candidates. I am very hopeful that sometime within the next 2 weeks we'll have some final decisions made, and we'll communicate that on our website. There is a particular site for Meck providers, so tune in and we will have those names of those specialists posted as soon as we make final offers to those candidates. What we typically do is we have an alphabet split. So you'll know exactly what network specialist, what network manager is working, supervising those specialists. So you'll just follow that person. That person will assist you with everything you need in your relationship with Cardinal Innovations.
Okay. My question is related to the data analysis. I was trying to see if you had a date of completion.
She said data analysis. Can you repeat your
Are you
question?
referencing the capacity study? Yes. She's referencing the capacity study. Do we have an estimated time that we'll complete that study?
So the capacity study is very labor intensive. It involves claims data, sites, services. We want to make sure that we get all of the contracts back from you. Without receiving those contracts, we don't know if there's a site or a service that is not correct in the contract. So until we get all of that information back from you, claims data, some external information we need, we can't complete the study. I will not commit the data analyst to a date because I don't do his work, but typically it takes about 2 months to get that data together, that report together. So have patience. It is coming. He started actually working on this a while ago. So 2 months is probably a good time frame. But don't hold me to that if it's not there, but he is working on it.
Tanya has given you the polite answer, and that's super. I'm going to give you the impolite answer. Stability is a key priority for us right now, stability across our markets. So just to be straight, I would not expect any big changes in the sites and services you're authorized over the next few, maybe for the rest of the calendar year. So we are going to do the capacity study, but it's not like the day that comes out, it's going to be open access for new contracts. Stability in the market is important. There's a lot of providers in the Mecklenburg market. This is a mature market, and just a kind of expectation set, wouldn't expect big changes for the rest of the calendar year. There's not a date. Nobody's got any date on the calendar circled. We're gonna get in the business here, see how things go, and see what the distribution is, see if there's a service need, look at what the capacity study says, and make decisions from that. But that decision will be months down the road. It's not going to be soon.
Hey, I just had a question about the info shares. I see here on the provider training schedule that you have them scheduled until May, and I just wanted to understand if these will continue because they've been very beneficial for the provider community.
We are committed to doing the info shares through May. Typically, Cardinal does not hold quarterly provider meetings. We basically surveyed our providers over the last 6 months. Attendance was sporadic, and we got feedback from providers stating that they weren't always interested in hearing about disabilities that weren't specific to their agencies or organizations. So what we decided to do is to not have our quarterly provider meetings, but rather replace them with high-touch targeted provider sessions. So we survey providers on an ongoing basis, and we also really rely on our network provider councils to give us feedback about the type of trainings that we'd like to have in the network. And so you'll see that we offer those on a very regular basis. So for example, through this transition, if what we offer in our 2-day training doesn't satisfy relative as direct support employee, for example, we'll offer a very specific training to just those providers where that interest is there for them. Does that help? Okay. Okay, you referenced contracts can be terminated by provider or Cardinal Innovations. Does Cardinal Innovations terminate contracts without cause? What is the Cardinal Innovations appeal process?
So the procurement contract states that either party can terminate a contract with 6 days' notice. So if you want to terminate your contract with Cardinal Innovations for whatever reason, that's your choice. And if Cardinal Innovations wants to terminate the contract with a provider, we give the provider 60 days' notice.
Thanks. What happens to substance abuse consumers that have already maximized their visits through MeckLink? Will substance abuse consumers get a 30-day pass-through beginning April so services and billing aren't interrupted?
So again, I'm not sure when you say maximize benefit, I'm not sure which services specifically you're referring to. So that may be, again, something we need to talk more specifically about. We are committed to working with our SA providers related to that transition April 1st, knowing that the authorizations won't transition into the system. The majority of Medicaid services for SA consumers are SAIOP or the SACOT services are, 3 to 4 month services. Sometimes they can go a little longer. So we will work with those particular providers. We'll probably do some separate discussions, conference calls with those providers on how to handle that to make those transitions seamless and get input from the providers.
We have another.
Okay.
If MeckLink denies or reduces an authorization request in March and the reconsideration process goes beyond April 1, how will Cardinal continue the reconsideration process?
Related to, is this speaking to existing denials that MeckLink has issued?
I believe so, yes.
So any denial authorization decisions that MeckLink has issued, MeckLink will follow through the end of that resolution. That will not transition to Cardinal. At any point in time, regardless of a prior decision, if a service has previously been denied, a service can always be requested at this time. So on April 1st, those services, consumers, families are welcome to request services, and we will make our own independent decisions at that time related to medical necessity or approval or denial of those services.
As foster care providers, will we be able to continue licensing new families past April?
I'm going to read that as a contract question. Is that how it was intended? Well, it's a card. So I'm going to assume that we're talking about additional foster care sites. So to the extent that that site was not in your contract at the time we received the data from MeckLink, then that site will not be added to the contract at this time.
Children served through foster care with health choice with value options authorizations are currently put into Alpha. How will they be handled with Cardinal?
So we will do a similar thing in our provider direct system. The problem with the health choice authorizations is when we seek them out of the value option system, they're linked to us, or they're linked to Mecklenburg currently. So we are not able to determine from the way that authorization is generated who the provider is. So for health choice consumers, it's really important when you know you've gotten a consumer authorized for therapeutic foster care that you reach out, whether it's to utilization management directly or your provider network specialist can also assist with that to let us know. Once we know it's your consumer, then we can link it to your agency. We can go to the value option system, transition that auth into our system, but we need to know that you're the actual provider to link that with first.
Stay there, Christine. For intensive in-home services, what are your authorization guidelines? First authorization, how many sessions? Concurrent authorizations, how many sessions?
So currently our initial authorization for intensive in-home is up to 16 units a month, and that authorization can be requested for 60 days. Based on the service definition, that's intended to be titrated over time. So if you're continuing to request our current max of 16 units per month, we would expect the clinical justification to support why that is unable to be titrated over the course of treatment as expected. And with intensive in-home, it is a child service. So under the federal regulations, EPSDT does apply. So if you feel that more than 16 units is needed, you can request, whatever you feel like is needed for that child and provide the clinical justification, and we will consider any request.
Thank you. Currently, we provide IDD services, innovations only, under Innovations Medicaid. We continue to get referrals for additional services that we are not contracted for, such as community networking, in-home skill building, residential, et cetera. Will there be an opportunity to provide those services in addition to our contract, or how is the request made to add those services?
As I mentioned earlier, there may be an opportunity to add those services later down the road. As Will mentioned, we're going to look for stability in the marketplace. So right now, if that service is not in your provider contract, that with MeckLink, that service will not be in the contract that you'll be receiving from Cardinal in the next few days.
I've got 2 questions up here. One second.
When the decision is made regarding IPRS services, how will that be communicated, and will it require a new contract? And will it extend beyond the fiscal year, meaning 6/30/14?
She said, we do not know. Right. I'm fairly certain that the hot sheet will still be going out on a weekly basis through the end of March.
Right. In addition, we encourage you to sign up for our newsletter, which is very similar to the hot sheet, and it goes out weekly. So between both modes of communication, we'll be sure to update you as soon as we know and can provide an answer.
I'll give you my email and my phone, because I am doing that now for MeckLink, and I'm happy to continue doing that for consumers and providers until such time as I might have another job. And then I will find someone for you before I go.
I want to follow up on the issue with foster parents, just for clarification. If the foster parent is in the process of being licensed now, so they're not yet a licensed home, they are not automatically included in the contract? Is that what you're saying? And how could they be included if not?
You got it? Okay.
If the question was if a foster care provider is currently in the process of being licensed and they're not a part of the contract with MeckLink, will that site be in the Cardinal Innovations contract? The answer to that is no. If they're not currently contracted with MeckLink, that data did not migrate over into our CI system, and you won't see that site in your contract. Again, we will address any amendments to your contract at a later time after we assess the market in the area. With respect to the state funding, that will be an amendment. If Cardinal were to be responsible for administering those IPRS dollars, then you would simply have an amendment to your contract, and that will be done very quickly, just like these contracts are going out very quickly.
I'll come right back. Oh, I've promised you.
I would like to know, when will families have an opportunity to change providers?
When will families have an opportunity to change providers?
They would have the opportunity to change after April 1st, or at any time if they wanted to get that request in before that. I think Christine said it was 2 weeks before April 1st. So, but at any time they have a choice of providers.
I'll be right back to you. Thank you.
Hi, I'm Brandy with Safe Alliance, and just a comment first. We're providers in Cabarrus and Union County, and I just appreciate the work that Cardinal Innovations and Meck are doing to really try to make this successful. I know it's a monumental task, so just a comment about that. My first question is, we have an awesome provider network specialist for Cabarrus and Union, and so when our Mecklenburg is added, do we get to keep that, or do we now have 2 people that we're connecting with? And then my second question is, we have a clinician who we've been trying to get paneled with MeckLink for some time. She is already paneled in Cardinal and Cabarrus and Union, but is at a Meck site now in our Lake Norman office, where we keep getting demands for service. So could we just add her, and instead of waiting until April, since she's sort of been in the pipeline?
Oh, absolutely. You can add her, but if she's seeing a MeckLink consumer, we won't reimburse for those services until 4/1. So you can add that clinician at any time. Just send us that information on the website, and we will link her to your organization. But as of April 1, that's when she could bill for MeckLink consumers. With respect to whether or not you get to keep that great network specialist, I appreciate that feedback, and I'm glad that you have one. What we've done in the past, if we've had an expansion into an area where a provider spans both areas, if that provider wants to keep that particular specialist, that's fine. All the communication regarding that specialist regarding that provider will flow through that specialist. It does get a little difficult sometimes when we're in geographical areas that are far and in between. We like to know what the right hand is doing. If they're requesting this service over here, everyone wants to know about it. So we have our own internal policies to make that transition smooth. But certainly that network specialist, because Mecklenburg and Piedmont are so close together, will probably be assisting you further with communication with your MeckLink specialist. But if you want to drive all of those documents through that person, we can make that happen. I appreciate good relationships. Then you're going to have to go to your MeckLink specialist.
You had one up there too, if you have a card.
I do.
And then anybody back here?
Will there be a clearly written procedural manual or document that will explain specific changes in the authorization, reauthorization, credentialing, and billing process?
So our authorization guidelines are posted on our website, and anytime we make changes, we do send out a communication bulletin letting the affected providers know what has changed, when it's effective, and then we update our authorization guidelines. We also have kind of tip sheets, checklists that we provide to providers that kind of outlines for you the clinical information that's needed related to authorizations and reauthorizations, kind of so that providers know what we'll be expecting. And then there was also claim credentialing. So
the credentialing process and procedures on our website, and it is really, really crystal clear. I promise you. Check it out, and we walk you through all of the steps in terms of getting a clinician credentialed. Also, the provider manual has a lot of informative information about our UN process and our network credentialing process.
There's a link to the provider manual directly on the MeckLink tab on our website.
to get to there easily. And as far as billing, all of that information is also on the website as well with some cheat sheets and actual online trainings.
MechLink understandably had to present a cutoff date for adding additional sites, and it kind of piggybacks on the foster care question, I think. And this is in terms of an alternative family living situation. The individual home was, the individual got the training, the person is funded, the cutoff date occurred. So they could not be added. And capacity study notwithstanding, that person would have to wait in order to join. So even though they're currently funded, they cannot receive services until the capacity study is completed.
Hello, it's me again. And I know you've already answered this question, and I just wanted to voice a bit of a concern that you know, there are a lot of therapeutic foster care agencies, and I understand the necessity to figure out a capacity study to see how many therapeutic foster care agencies there might need to be in a given area. But my biggest concern is there isn't a need for a capacity study to understand that there is a huge demand for therapeutic foster care parents, that there's a big need for the kids in our area to receive therapeutic foster care, and if there's a family out there that's willing to take a child, that we shouldn't delay that process. And so I just kind of implore you to take a look at that within your contract process.
And in addition to that, my second part of my question then is, how will you know that they're out there? In the example that I gave, the person went through the process, they've done the training, the individual is with them because they aged out of child and adolescent services. They went through MechLink system of unmet needs, registry of unmet needs, got the individual funded, the cutoff date occurred. This young lady is in services, the provider is doing the service. I couldn't add the location because of the cutoff date. So what am I to tell that provider, and who should she be speaking to now?
So I hear you and I understand the need because you have boots on the ground. The capacity study really does look at who's out there, what the availability is of homes. We do an extensive therapeutic foster care directory at Cardinal Innovations. We look at whether or not a home is a two-parent home, or same-sex home, pets, close to a school. We really have put a lot of work into this, so it's not something that is taken lightly. We will look at the number of therapeutic foster care homes that are currently contracted with MechLink now. We will also look at the area in terms of demographics. Where are those homes located? How many homes are there? Are they licensed or unlicensed AFLs? We'll do that for all residential sites. We'll also look at the demographics in terms of the consumer data that has been migrated over into the CI system. The ages of the consumers, the past history of those consumers, and based on that information, we'll decide, is there a need for additional therapeutic foster care homes? Sometimes the numbers are not the reality, and if that is the case, we'll look at that and on a client-specific basis at a site if there's a true need determined by and if we hear and understand that there is a need. But it's all clinically driven, but it's also numbers driven because that's real and it does make sense and it does add up. So I'm very passionate and I do hear what you're saying, and we do want children to be in the best settings, to have the best care. That's our goal, and I know that's your goal. So I don't want to draw a line very deep in the sand, but we will look at the capacity study and take that into consideration. And there won't be a dynamic change in the market, as my COO has reminded me. But we will look at taking care of the consumer first and foremost as well. So it's going to be a balancing act. We want to do the right thing.
Got a question back here.
So the questions that are being directed to this website, I just wanted to make sure, is there like a specific entity within Cardinal that will answer those questions, or will those be funneled like to the Access Department or something like that? And then if there's a time frame on when the questions will be answered or the concerns?
Okay, so we have a team of 20 attorneys and paralegals. We call them the Network Operations Command Center. And right now, the supervisor of the Network Ops Command Center sees all of those emails. He has been with us for a while. We've done an expansion project before, and he's also been with us for our provider data quality cleanup project. So he is very familiar with all of the departments in Cardinal, and he will forward any email that is not network related to the proper department within Cardinal Innovations. We do have a time frame. We're asking that we return those emails, if possible, answers to those emails in 2 days. We know that those emails will come in volumes. We hope not, if you look at the website and check out all the good information we have out there. But if for some reason there are a huge volume of emails, we're going to do our best to get to those in 2 days. No worries. I'm copied on all of them, and I am a true workaholic. Yeah, I shouldn't stand up here and say that with behavioral health professionals. So they will get answered, and the goal is 2 days. And if you cannot call Access for your questions, definitely just go through that link, and we're going to route to the proper department.
I have a card. Will all providers currently under contract with Meck be given a contract with Cardinal and accepted in the Cardinal network? If not, why not?
All providers in good standing are being sent contracts this week. There's a few providers not in good standing who would not be contracted. They'll also be specifically notified by mail and followed up with.
It was a card.
Don't ask that question.
Oh, yeah. That's a big trigger question, actually.
So, but every provider, help me here, every provider who's currently contracted with Meck should get one of three things from Cardinal Innovations. They should get you should get either a new contract, or you should get an amendment to your current contract with Cardinal, or you should get a letter disclosing that we're not contracting with you. So you're not going to get nothing. If a week goes by and you get nothing, right there, write in and say, why don't I have anything yet? And maybe somebody in your, it depends on the addresses we have, depends on who's in your office opening your mail, a lot of things involved. But every provider we know of that we've been given the list from Meck our systems are set up to send every one of those providers listed one of those three communications.
What's considered good standing?
Thank you. Good standing means there's no sanctions. Means you're not on a hold from DMA and for payment. Means you've never been terminated by Cardinal Innovations. You've never reached a settlement agreement where we agree not to work with each other in the future. There's a few other reasons also. It's a short list, but that's kind of defines what is not in good standing. Everybody else would be in good standing. If you've been terminated by Meck Link, that would not be in good standing. You would wonder why it would be on that list, but you know, data list, nobody has a completely clean data list, nobody. If there's an outstanding payback that's never been paid back, that'd be a problem. Yeah, there's a few reasons.
With respect to the innovations authorizations and honoring them as of 4/1, all the transitions, are the providers going to be responsible to upload those or to request those services or what's left of those authorization services in the provider direct, or is everything going to be uploaded from Meck Link to Cardinal? Because it's two different billing systems, and that's a little bit.
We will get the data transfer directly from Meck Link, so we will transfer the existing auths into our system, so you'll be able to verify that your auths are there for the services. We certainly encourage, once that's done, we'll let everyone know, but to double check that, make sure it looks like everything carried over. Again, like Will said, we always run into those data glitches or something didn't match up 100%, and then just alert us of any problems, but it will all be an electronic transfer.
My question is about how we will get paid. Currently, funds are transferred into Mecklenburg County, and we have auto deposits through that. Will that continue, or will there be a different system?
The EFT process is available to all providers, and it is online. We will make sure that it's in the next info source so that you can get the information that you need. We preference for people to get the EFT. It's a lot faster, a lot cleaner, and most of our current providers are under the EFT process.
We've got about 10 minutes left, and I'd love to encourage you guys to fill out the survey form, please. Take a few minutes and do that. And if we have any other questions, I can float around. Okay.
If a client currently has more than one insurance, particularly Medicare and Medicaid, you have the option of billing either or if we have to bill Medicare as the primary insurer, if that rate is lower, what's the cardinal approach?
Yes, if the consumer has Medicare or other insurance, that insurance has to be billed first, and then you submit the claim to Cardinal with that COB information on there. Also, if you get a denial from Medicare for some reason, you have to put that on the claim as well, the denial reason.
Whoever here had a question?
Can I add a comment about Medicare? If you are a Medicare paneled provider, please let us know, because we get calls about Medicare all the time. And if we can refer those callers immediately versus deferring them back to Medicare, we'll absolutely do that on their behalf.
With RDSE, with innovations, is that going to also be honored until the plan year's up?
Yes.
Anybody else? Any floating cards that we missed that you want to get answered now? I'm just kidding.
No one else will speak. With RDSE, for people that haven't been approved but the request has been made in MechLink, what's the process for that at this point?
If I understand you correctly, the request has not been made with RDSE, with MechLink for RDSE?
It's been made, but it hasn't been responded to. And it's been over a month, I believe.
Well, as you know, that response may be forthcoming, and so it's with MechLink until April 1. But we're going to take those hours and those services, those will migrate over to Cardinal, and we will honor all of those services and hours.
If anyone has any questions similar that are involved with MechLink, if you will fill out a card and write down your information, I will take those cards and get back to you, or I will get someone to get back to you. That goes for the Autism Society back here too. Any other questions?
Before we adjourn, on behalf of Cardinal, I just wanted to express a very, very warm thank you to the MechLink staff for working with us throughout the preliminary portions of this transition. And also a very warm welcome to you as the providers and key stakeholders for being a part of this effort as well. We really are excited about this endeavor, and we know that it's going to be a success. So thank you.
MechLink Behavioral Health Care. Our voice, our lives, our community.